As Nate just showed us, the stress that some healthcare workers are facing right now is almost unimaginable. We want to bring in Dr. Jeffrey Gardere, our top clinical psychologist, to talk about the stress itself and the impact this could have in the long run for millions of healthcare workers across the country, and perhaps most importantly, what they can do right now to manage that stress. Jeff, good to see you again.
Great to see you, and what an important and timely topic right now.
You're going to have different extremes. You've got some healthcare workers that are going to deal with the madness of patient after patient, especially in New York City. You're going to have others who are dealing with cases that have nothing to do with COVID-19. Everyone, though, sharing in the stress as the whole system is being pushed. Let's talk about that stress itself. How is this different than other times?
You also have to throw in the mix the lack of adequate protective clothing, the masks, the gloves, the gowns. So that puts them directly in harm's way, whether they're working with the COVID patients or just in the area of that. So basically, we're asking these frontline health workers, nurses, doctors, and so on, all the other great health providers to basically put their lives on the line because they are much more at risk. So we're seeing that along with these 17-hour shifts. A lot of these healthcare workers are really starting to melt down right now.
Let's talk about how they are able to manage the stress and do their job, because the truth is, I don't want anyone to get the impression that any of these first responders are not doing their job to the best of their ability. They are pushing that stress aside and they're doing their job, and then they're dealing with it when they get home.
They're giving it everything. These are the super soldiers, and we absolutely congratulate them. What we see going on is that the amount of stress that they have added on to the fact that, you know, there are some hospitals that we have seen in the news who have not been as compassionate with their own healthcare providers. That's another level of stress. But I think what they need, Bill, they need to be supportive to one another. They need to have their peer support groups. They need to stay in frequent contact with family if they can. And the hospitals must provide them resources as far as telepsychiatry, telepsychology, so they can debrief and talk to someone at the end of these grueling 17-plus-hour shifts.
Yeah. Thank you, Doc. Great point and well said. Always appreciate you. See you tomorrow night.